The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Earlier this week, the case came to my attention of a senior in Sydney who was admitted under emergency circumstances requiring surgery to the Cape Breton Regional Hospital last fall. And upon his arrival, because there was no surgeon available, he was rushed by ambulance to Antigonish, where 6 hours later he received the surgery. While there was a surgeon in Antigonish, there were no beds available, and so this patient was returned to Sydney by ambulance to be admitted late in the afternoon the next day. Mr. Speaker, I'd like to ask the Premier, when our healthcare system is stretched so thin as to require a senior to travel 434 kilometres in the course of an emergency surgery, does he not understand why people would refer to that as a crisis?
Yes. Honourable Premier.
Mr. Speaker, I don't know all the circumstances associated with the case that the honourable member brings to the floor, but it's unacceptable.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, paramedics and ambulance services are a lifeline for people in medical crisis. When we call 911 in any community in Nova Scotia, it's essential that these people be able to respond. The crisis created by this government in healthcare, however, has paramedics and ambulances stuck in emergency rooms accompanying the patients who are lining the halls there. Mr. Speaker, this morning at 20 minutes to 7, here in the Central Zone, there were exactly no ambulance units available to answer calls. Zero. Mr. Speaker, how does the Premier respond to his government's failure to meet even the most basic standard of the availability of ambulance services?
The Honourable Premier.
Mr. Speaker, we'll continue to work with our partners across the province. As all members of this House would know, including the honourable member, the fact this is not a new situation in our province. We've had this issue where ambulances have gone into emergency rooms for a very long time, where they've been held up for periods of time, which in essence, during the ambulance services, caused a domino effect across our province, where we're leaving some communities vacant. It's unacceptable. We recognize that. We'll work with our partners to alleviate the challenges and look for new opportunities to see if we can solve what is an unacceptable situation. Our highly trained paramedics should not be waiting in hospital parking lots or in hospital emergency rooms. They should be in their rigs, in communities, ensuring they're responding to the needs of communities.
The Honourable Leader of the New Democratic Party on his final supplementary.
Thank you, Mr. Speaker. When the Premier was questioned by media not long ago about some of the questions that have been, the criticisms that have been directed towards his government, he said, "We are going to govern as we have governed. We won't listen to the noise." So here's the question. As the evidence of a healthcare crisis continues to mount, does the Premier not realize that it is he who has become the noise and that he continues to lose credibility as a steward of the healthcare of the province?
The Honourable Premier.
No.